all those people that do those YouTube videos?
This is it.
Okay.
We still have a couple minutes even more. Yep. All right. We got 2 more minutes and we'll start.
Okay.
We'll make it official. We got the people that are hopping on there. That's cool. And whoops, wrong button. And when we do, what I'll do is when we talk about that picture, I can do the screen share. Can I do that now? No, it may not let me. We probably look pretty silly right now. Okay, so then I can just go to a screen share. That's not gonna. Why is that not working? All right.
Make sure you speak up, Sylvia.
This microphone will pick you up too. So 7:29. We got 1 minute. We're going to talk about the ins and outs of this, which I'm excited.
Do.
I say we just go, and people will hop on, and when we see them ask questions, they'll pop up over here, and we'll do our best to answer those questions as we can.
Okay.
But this is new, and this is exciting for us. You all know that we have been using regenerative medicine for about 2 years now, with osteoarthritic conditions, with some autoimmune conditions, and other really cool stuff. In fact, Thursday, we get to do an IV for a guy with COPD.
Great.
Yeah, that's awesome. Yes, we're excited about that. So, but this new, what's new to us is this whole world of aesthetics. So we've been talking for 2 years now about how stem cells, the 3 main things they do is, number 1, they reduce inflammation. Number 2, they they modulate, control your immune system. And number 3, actually help you regenerate and regrow new tissue. But when we use them in an aesthetic setting, they actually have some very, very powerful effects on your skin. And they actually have a lot of anti-aging properties. So stem cells are one of the very few things that we know about that can actually lengthen the telomeres on your chromosomes, which basically means they're very much anti-aging. They're not the found youth, but they're very much anti-aging. When you apply that into the skin, we're going to talk about some really, really cool stuff. So this is Sylvia. So Sylvia Rife is our nurse practitioner. She's, how many months has it been now?
3.5.
Oh, she's been with us for 3.5 months, which was about 1.5 years too late. She should have been here a lot longer ago, but I was stubborn. But she's been with us about 3.5 months, and Sylvia's been fantastic. We've had nothing but praises from our patient population that have had injections done by her, and I really appreciate her. And I appreciate you joining me to talk about this tonight. I've been pretty hands-off with this whole process, and Sylvia's kind of taken it by she's taking the reins and just taking off with this. So we're going to introduce how we do this. We're going to talk about the 3 options that are available. And then what we'll do is on the side of your screen, I don't know how this looks on your screen, but the link there at the top of the message section, also in the offer section, the button says book your consult now. So if you click on that consult, it'll actually book a consult where you can actually talk to Sylvia. And we're not going to charge you anything to do that, so that we can talk about what options are going to work best for you. So let's go through. There's 3. First off, let's talk about that thing over there. Yes, let's check that out.
Okay. This is our RejuvaPen NXT. I do not have a needle in it just yet. The tip that we're using has 12 needles in it, and it does varying levels of depths as well as how fast we do the needles. And so there are 3 levels that we do is the hyaluronic acid, which is just your basic micro needling technique. It does work like a microdermabrasion, and it helps to rejuvenate the skin, but not quite to the level that PRP does or what the exosomes will do.
So how big is the actual needle?
Oh, the needle itself, very small. Okay, you see the tip of this? The needles are, the round piece that's in there is only about that big. So
I have nothing in my, here, let me see that thing again. So here's my keys, just for a reference. There's a key. There's the tip. There's going to be 12 needles inside of that. So it gives you an idea of how small those needles actually are. So when we're applying this, it's not painful.
For some people, it may be a little bit painful, similar to like tiny little pinches, but we can use lidocaine cream that will help numb the skin that we do wash off before we start doing the microneedling process, especially if we're using PRP or exosomes. And you may have a little bit of discomfort. There may be a slight little bit of bleeding, but most patients, most people that have this done don't have an issue with it at all, even without lidocaine cream.
Okay, so if we're starting with just the first level, we're just going to do hyaluronic acid with microneedling. What does that do?
The hyaluronic acid. The hyaluronic acid helps to bring in the moisture back into your skin because it helps to hold on to the moisture that should normally be in your skin. And it works like a microdermabrasion, so it takes off that top layer of skin, kind of smooths it out.
And in the state of Idaho, who can do that? Just had that conversation.
Yeah, just about anybody can do the microneedling with hyaluronic acid.
So it's not really regulated. You could probably go to the mall and get it. It's kind of freaky.
Yes.
Okay, so it's an option. We can do just the microneedling, and it is helpful. It's very popular. But what's the next thing on the menu?
The next step is with the PRP, which is your platelet-rich plasma, which has all of the growth factors and the cytokines and everything in there that helps rebuild your own cell structure to help build up that matrix that helps hold that skin in place. And it helps to regenerate the skin cells and kind of smooth them back out. And so without wrinkles.
PRP, I know you guys have talked about this before. PRP, like Sylvia said, is platelet-rich plasma. And what happens to start this is when you come in, we're actually going to do an IV where we're going to take a little bit of your own blood. We spin that blood down in a centrifuge. And when we spin it down, the red blood cells, all the solid matter is going to sink down at the bottom, and it's going to leave us this nice, fluffy yellow layer up on top. That layer, we suck that layer off, and then we're going to put that. I'm still not clear on how it goes into the actual.
It doesn't go into the pen itself.
Okay.
There's two ways of doing this. We microneedle with just the hyaluronic acid, or we microneedle with the PRP.
Okay.
Everything that I have seen so far is the best option is to microneedle with the PRP. And whatever PRP is left over after the microneedling process is finished, we then put on your skin. It stays on there for a couple hours. Then you can wash your face.
Fantastic. So why would someone choose to do PRP, to include PRP over just hyaluronic acid?
Because the PRP is going to help rebuild that collagen and fibrin that's already in your skin that's kind of gotten saggy and weak, and as you age, those things don't regenerate as well. This helps that regenerative process and helps those cells to regrow your collagen and fibrin again. Right.
So using PRP is going to get those results faster, bigger, better. Okay. Now, the next part of this blows my mind. Okay. What we've known, and I said this earlier, what we've known about stem cells is they are anti-inflammatory. They regulate and modulate your immune system, and they regenerate, regrow new tissue. They break down scar tissue. They lengthen telomeres or anti-aging. All this stuff happens not because of the stem cells themselves, but the stem cells release little chemical packets that tell your cells what to actually do. So growth factor, cytokines we already touched on, but these also include things like messenger RNA and microRNA, which are the messengers that tell your body, hey, things aren't the way they should. We need to firm and tighten things up. That is a stem cell exosome. They are the actual chemical messengers released by stem cells. And what's cool is when you use the exosomes, which, we're now into third generation of regenerative medicine. It started with your own stem cells. Now we've moved on to umbilical cord stem cells. And now in the third generation, we're talking about just the stem cell exosome. So it's like taking stem cells, taking the most powerful component of those stem cells, concentrating it down and using it therapeutically. And in this case, for aesthetics, because we can use these stem cell exosomes to get even more effect than we would with just hyaluronic acid or PRP.
Mm-hmm. So the exosomes are it's like 10 times better even than the PRP. So if we use the PRP with the exosomes, now we're really getting great results and much faster results. Your healing process is going to be even faster because those messenger cells are telling your own cells, this is what we need to do, and get going.
That's so cool. I'm going to share a text message that I got the other day. There was one of our favorite people. I wanted to make sure. I told her she would be the first to know when we had this to offer, so I did. And I texted her. And oops, I got to find it first. I texted her and I said, stem cell exosome facials will be available starting the Monday before Thanksgiving. Where I was a little ahead of that. They're not yet, but they're going to be soon. And she said, thank you, my face and gobble neck. Thank you as well. And things just kind of went downhill from there. But would you say that the more, what's the word I'm looking for, to be very careful and the more your skin has aged, the more you would recommend doing exosomes over?
Yes. Because it's actually going to tell those cells that they haven't completely died off, but are no longer functioning the way they did, say, when you were 20. They're going to tell them to function more like they did when you were 20.
Right. So looking at the three options again, hyaluronic acid, how many treatments does it actually take?
5 to 6.
5 to 6. Using PRP, how many is it going to take?
About 3.
And using exosomes? 1,
maybe 2.
So faster results, quicker results,
better results
by using the exosomes.
Right. This helps reduce acne scars, all your normal aging, signs of aging. So it's not just the wrinkles. It's not just putting everything almost where it was.
That's fantastic.
Smooths out the skin, but it also helps with any of the aging spots that you have on your skin, the sunspots. It helps to reduce the appearance of those.
Acne scars, that was a hot topic at my house tonight.
Absolutely, acne scars.
Yep. Awesome. Well, I think we've covered it.
And it also works everywhere else on the body. You can use this pen anywhere.
We're going to talk more about that later because there's even more coming.
So if you have acne on your shoulders,
so
do it there too.
Hair loss.
Oh, hair loss.
Hair loss and hair regrowth isn't necessarily a microneedling thing. It can be a direct injection, correct?
It's a direct injection, but it can be done in conjunction with microneedling.
How cool is that?
We can inject the exosomes and then microneedle with PRP over the top.
So get rid of scars, get rid of the sunspots, get rid of the wrinkles, younger looking skin.
Mm-hmm.
Awesome.
Smoother.
Can you see why we're excited about this? Oh, fantastic. No one's asked us any questions. I think we've covered. Is there anything else you want to cover?
Not that I can think of.
Hit that link. Get on our schedule. We're not going to charge you for the consultation. Let's just see if this is a good fit for you. And we could literally have better looking skin before Christmas at this point.
Yep.
So awesome. Thanks a lot. And we will see you guys very soon. I will stick around for a little bit. So if you have any questions that pop up, don't be afraid to ask. Thanks for joining us, guys. We'll see you on the next one.
Good night.